Well, Luke, fantastic to have your time today. And I wanted to talk to you about an issue that is very pressing to women of a certain age.
Yeah.
And I am of that certain age. And I'm not quite sure whether we talk enough about the menopause. And so I was really grateful to have the opportunity to talk to you, to maybe bust some myths around it, but also get some facts, and also to actually talk about the reality of menopause. So that's
well, I think it's really important, you're right, and it's becoming more and more people are prepared to talk about it, and that's one of the hardest things, that actually your doctor wants to hear about this, because there is an important thing, and most importantly, things we can do about it, which is why I think it's so important to talk about it.
Yeah, and you mentioned that as a doctor. I mean, I know previously you were a doctor, practicing doctor, now you are still a GP. And did you find that many women would come to you?
Yeah, definitely, more and more coming forward. Or what would happen is they would come about something else, like one of the symptoms. So the typical one is feeling, just feeling a little bit confused, or things get muddled in your head. And actually, you get a lot of people coming in saying, "What's going on here? Is it my stress? Is it the fact that am I getting dementia or something like that?" And actually, when you talk them through it and you have a conversation with them, it becomes patently obvious this is part of the menopause, and people don't assume that, because they always think immediately of the night sweats and the fever that goes with it. Those night sweats are so important and a big indicative of it. But they're not the only things that people suffer.
Well, it's so funny you should say that, because thank goodness you've said that, because I honestly thought I was getting dementia at one point. I thought I'm just getting really, really confused about things, and I just thought it was me just getting older. But that is a direct impact, is it, of the menopause?
Yeah, absolutely. So the menopause, the flushing is the commonest one that people know about, but often confusion or depression, feeling low, losing your sex life is another one, and then some more of the common sort of intimate ones are recurrent water infections that people sometimes go through. So it's really important when women of a certain age start to have repeat water infections, it's a question you should ask about. And also it can affect your libido and your sex life, so you can get dryness down below, or it's splitting, which is a common thing that people can happen. So these are all signs of the menopause that make a GP think, "Oh, shall I just ask about this?" And the common stage to go through the menopause in the UK is about 51. It gives you flavour where people are, but it can come at any time between that sort of stage, either side. So.
There are so many questions I want to ask from what you've just said, but just think about my own experience. I think mine was really, as I was getting towards 50, was feeling that a little bit more tired. Certainly noticing I was getting irritable, though I've never admitted that before to anybody, and please don't tell anybody else about that. And also, I think it was just that confusion, that forgetting things. However, it's really interesting when you talk about other symptoms on that. But just thinking about the kind of help that really you should get, because I didn't really feel as though there's anybody I could talk to. And I suppose I used social media, or just had a look, did some Googling, that kind of thing. But what would be the first port of call, do you think? What should we be doing?
Well, absolutely. Everyone always worries about this. Are they going mad? Is it really a thing? Because it can be quite gradual. It's often quite hard for people to realise it, and it'll often be picked up by other people around them as well, to saying, "Is everything okay?" And you put two and two together and go, "Oh gosh,
can I just stop you on that? Because that's a really important thing. Now, I know some men whose wives, I think, they are going through the menopause, but they're not acknowledging that they're going through the menopause. So what you're saying is this is about a woman going through the menopause, will then elicit some kind of signs that they recognise. I'm just not sure that's true, Luke, actually. I just wonder if there's some signs that women have that maybe they don't recognise, but others around them recognise. And I'm just thinking, and I'm angry, if I could just imagine someone say to me, "You're being unreasonable," or "You're being moody." I'm not sure how I'd take that if I was feeling unreasonable.
No, it's a really, really difficult one as well, and that's part of the problem why it's so important to do a video like this, to make people aware that, can I put all these different things together and just ask the question, I'm at that age, is it possibly the menopause? And the first place you can go and speak about it is your GP, because the difficult thing with the menopause is it's a big topic, and actually there's lots of different treatments for different people. So for some people, it might just be a lifestyle. For some people, it's non-hormone treatment. And for other people, it is the HRT or hormone replacement therapy that we talk about. And it's finding the right one for you. And there isn't necessarily the right time that fits, and you might want to move between the different choices as well, which is really, really important. So it's trying to pick up on those symptoms and understanding that this might be something going on. So if you're on your third or fourth water infection in 6 months, that's a time to go and see your GP and say, look, this isn't quite right, I need to get it sorted.
Yeah, and just to unpick that a little bit more, again, you've said so much. So a water infection, I understand, you know, sex that is difficult, I get that. Yeah. But when it's your emotions, that maybe you're just not quite sure that that's the emotion that you're eliciting to other people, how do you know that? Because when you're in it, it's really difficult to know you're being unreasonable or to, you know...
Yeah, there's no easy answer, and it is often people will come in saying, I've been having, you know, problems at work or problems sleeping, things aren't quite right with my relationship and what's going on from that side. And so that is another avenue that people come in thinking they have got depression or that they've got anxiety, or they're not coping is another common one, that my relationships are breaking down, why is this? And it's a clinician's job to try and work our way through and say, well, have you thought about this? Does this all fit? Actually, if you haven't had your period for a year, there is a blood test that you can do. Now, it's very hard with the menopause to do it definitively with a blood test, especially if you're what we call perimenopausal, that is going towards menopause but not quite there yet, but it can be helpful to elucidate what is going on. So it's this mixed picture that comes together, the physical symptoms that are coming through, what's happening with your period, but also then the picture around it to try and say, well, this looks like if it's, and as soon as you start trying to do something and treat it, then that as well in itself helps to reassert what you're thinking about.
I mean, that's just reminded me, I had forgotten really why it was I went to the GP in the first place, and it was my periods changing slightly, not always, not every month, but changing. But also I was feeling tired, and I went along to the GP, and they did do I'm sure they did a blood test at the time, and they suggested that I go on HRT. And I have to say, you know, for me, there was no decision. I thought, this is for me. I also, at my exercise, I'd always been doing lots of exercise, but I was making sure that I was doing it. But there's different kinds of HRT, and I always had the tablets, not realising that you can have patches as well.
So there's patches, there are creams, there's even nasal sprays.
Hold on, a nasal spray?
There's localised stuff as well, so that, for example, if particularly the sexual aspect is or dryness is a particular issue, then you can use hormone cream, particularly in those intimate places. So there is a huge variety out there, and that's only the hormonal stuff. We haven't even talked about the non-hormonal stuff.
What happens if you confuse the nasal spray with the vagina?
Hey, I'm not going to get into that. But there is a vast sort of array of things out there, and there's also for the non-hormonal stuff, a lot of people get very stressed when we say, well, if I don't want to take hormones for whatever reason, what else have you got? And we say, well, things like antidepressants are actually used to control the flushes. But people go, hang on a second, you want to put me on antidepressants? I'm not depressed, I've just got flushing. But actually they're used for a lot of common other things as well. So that's really hard to try and get across to people, because they're saying, well, not only am I coming in feeling stressed, down, I'm a bit tired, you've told me it's my menopause, now you're putting me on antidepressant. Well, no, actually it's a really commonplace, and not many people again talk about that this is one of the other non-hormonal treatments that you can use, as well as, you're right, the lifestyle stuff is really important. So we know that keeping your weight down and exercise make a real big difference. And you can even use something called CBT, which is cognitive behavioural therapy, to help people get through that mind fog. But it's finding the right combination for the right person. And there are biological risk factors as well that you have to think about. So if you've had breast cancer in your family, that would make a big difference of the choice you've made. Or if you've got osteoporosis in your family, and that's thinning of the bones, You might want to actually say, no, this is a really good reason to go on HRT to protect my bones. And so there's a lot to weigh up in it. But the first thing is being able to have that conversation and go and speak to someone and say, they'll listen to you about it.
So, we need to do a whole series on this because there is so much. But I absolutely agree with you. You know, it's really difficult to have those conversations, but it is really important to have those conversations as well. I'm just thinking about alternatives, and I'm thinking about the age span as well, because I've had friends who went through the menopause early, you know, before they were 40, which is quite young, I guess. You say the average age is 51, but they did things like think about red clover as an example. I mean, I don't know whether any of these are helpful.
Sure.
But it's interesting what you say about antidepressants and different uses, because I think what we don't realise with medicines is that they are multi-use as well, aren't they? So they can be used for different things. So when we use the word antidepressant, it's like, I'm not depressed, but actually it's not for that side of the menopause.
It's absolutely, you're absolutely spot on, and often they will cross over, as you pointed out. The symptoms can be complex and mix over, but no, they're actually used for what we call the vasovagal control, i.e. things like the sweating, the flushing, these kind of things to help deal with it. Or another one is gabapentin, so that's a painkiller that's also, again, used to control some of the symptoms. So often there's a crossover in medicine that lots of these medications have, that you may be surprised when your GP suggests this might be for you. And I think that's the key thing with all of this is the symptoms can be quite specific to the person. It's having that conversation with them and saying, what is it important to you? And there's even fundamental things like whether or not, you know, many people would have had a hysterectomy, so may have their ovaries, may not, may have their uterus, may not. And that has an impact over the choice of the treatment that you may well want to use. So the key thing is to, if people in their, you know, 40s, 50s, 60s are noticing a change in their behaviour, noticing a change in their waterworks, or getting the flushes, or just thinking things aren't quite right. Menopause could be the reason it's causing it. Go and have a chat with someone about it to see if you can put it all together.
And I guess actually as you get more towards those later years as well, it's highly likely. I mean, I've been on HRT for quite a while now, and my doctor said when you get to 60, you know, we need to have a rethink and see what happens. So when I got to 60 this year, I went along to, well, it was a virtual call with the doctor, and I hadn't realised I was on the tablets, which they wanted to take me off because from a breast cancer point of view, it's better to go on the patches. And then I went on to the patches. Oh, and I've had the devil's own job making them stick. And they've had to use like, is it surgical cleaner to make sure, because my skin's quite oily, because I use lots of moisturiser to stop me looking old. But I didn't realise as well that you don't have to have a period. So for all this time being on HRT, I'd never gone to the doctor. I'm just quite happy. They did the regular checkup, making sure that everything was okay. But we never reviewed what I was on. And then all of a sudden finding out that you can go on a patch that you just change once a week and don't have a period, it's like, oh my God, this is incredible.
That made the difference.
I mean, wow, that is, you know, you men are very lucky on these things.
Well, absolutely, but it's really important because actually whether we're talking about the menopause or contraception, it's finding what works for women, because of course there are contraception pills that can do that. And some women really love to have their period because they know that they're not going to conceive and it's important. Right. Others can't wait to get rid of it, and you say there's an opportunity to do so, and they're very, very happy to get rid of it. I think the key thing with that is noticing a change in your pattern, and also once you are post-menopausal, if you're getting bleeding, actually that's a really, really important sign not to miss, because that can be a sign of cancer. So post-menopausal bleeding, so bleeding after you've been through the menopause, is something we'd want you to go to your GP to get checked out. Doesn't mean there's lots and lots and lots of reasons why that can happen. But one of the ones you wouldn't want to miss is an endometrial cancer, so cancer inside the uterus. So if you don't have a uterus, that's not going to be a problem, but for those of you who do, who've been through the menopause, it's one of the things we try to catch up on.
So again, lots to unpick there, and I know we haven't got an awfully lot longer, but I'm just thinking, in terms of getting checks, I go every year just for a check, just to make sure that I'm okay. Likewise, I do that for my asthma, I do it for my blood pressure, because it was high, but obviously medication is helping me with that. Is there a point where I will go through the menopause then, and that will be over? Or am I through the menopause and just stopping not being through the menopause?
Yeah, so you will go through over that period of time, and we talk the menopause is defined as no periods for a year.
Right.
That's the broad concept of it. But once you've been through that, you are through the menopause, out the other side.
Okay.
The question is, your symptoms can still last after that point in time. So it's all about symptom control and how it affects you. So if we go back when HRT first came on the market, quite a long time ago, it was the all singing, all dancing, and we put lots of people on it. But then we were very nervous about it because we realised that it actually can cause increased risk of things like breast cancer, and we thought maybe that's not a good idea. And they'll often check your blood pressure when you go to have to have your follow up, because there can be increased risk with heart disease. So there's a balancing. Now we've completely changed on its head over the last probably 10 years to say, look, it fits with what the woman's symptom control is and how can we get that best sorted for her. And then some of the other risk factors as well. Strengthening your bones might be a really important thing for you specifically. So once you are through that, you're through the menopause phase from that point of view. And that's where if you start getting bleeding after that point, you need to know about it. The question that's still unsure about now, and it varies for different people depending on all those risk factors, is at what point do we stop people? Do they want to come off? Do they want to try? And your doctor will have that conversation with you every year to say, well, usually it's in 5-year cycles to decide what we're going to do, but that's not always the case because it depends on what's happened to your health in between. But they should be reviewing it at least yearly to see what's your blood pressure doing, what your risk factors are doing, your weight, how's it all going, how are we controlling your symptoms, and what are the pros and cons of keeping you on it, and what are we trying to do versus taking you off it? Because it may well be that you stop and actually your symptoms go away. It may well be that some people start to notice them come back again, and this is the difficulty. And it's about having that conversation and getting to know with your doctor what fits you and what you want from the whole situation.
And I mean, I'm just thinking something practical. If you're having, obviously, say you're going through the menopause, I'm not sure, I don't understand really whether HRT is preventing that. Does it mean therefore that you can get pregnant, and do you need to have the birth control as well, or?
So HRT is not a contraception. Okay, so that's really, really important.
So it means you can still get pregnant?
Yes, you could do. I can't remember the name of the exact figures of exactly when that is, but there is a chance with it. It is not a protection from there. But once you've been over, and we know you haven't had a period for a year, then that would be the usual bog standard time that you're not going to. And it varies on age as well. I think it's 50 and 55 is a cut-off, but I need to check that out. But yes, there is a risk when you're first going through certainly for the first year, that you could still become pregnant, which is important to pick up on. So we often say barrier methods or something like that, a condom, to cover that off, to be aware of.
Wow, well that's been, honestly, it's all been so helpful. I just wonder, it might be worthwhile just doing a quick recap really on some top tips, maybe from yourself, then I'll just do some reflection, but top tips that you have for anybody who lives with somebody who is going through the menopause, or they think might be, or somebody who is going through the menopause?
So I think it's a really good question. My top tip is to think menopause. If you're in that age bracket, 40 to 60, and you're starting to have the sweats or flushes, or you're starting to feel foggy in your head, or you're getting some waterwork symptoms, or sex isn't the way it used to be, those are all possible signs. You might want to go to your doctor and say, look, could I be going through the menopause? They can guide you with talking all you through the history, what fits, possibly some blood tests, but not always, to help you identify what it is. And then trial you on something that may well fit to make things better. So there are also lots of lifestyle treatments, non-hormone treatments, and of course HRT that can really make a difference. And I think that's the key thing, that there are solutions out there. If anyone's going through this, it's to talk about it, recognise it, and just ask that question: have we thought, could it be the menopause?
Brilliant. And you just used a word there that was the reason I went to the doctor, was that fog, that it just wasn't quite me.
Yeah.
And I think that's a really great example. So my top tips would be go and see your GP, talk to them, and just find out a little bit more. I know, obviously, just a final thought is men and women. You're obviously a male doctor. Do you think that women prefer to go and see women doctors? Because I'm assuming that's available. I mean, how do male doctors think about this?
Yeah, absolutely. So, I mean, it's the woman's choice. I think this is covered so much more now. You know, I graduated in 2013, and you spent a lot of time going on the menopause discussions about it. However, it's becoming a specialist subject as well. So we have lots of GP colleagues out there who specialise in the menopause. But actually, that's a good thing, because the main thing is identifying those issues, giving people the chance to think about it, because it's not going to be a one-stop fix that you'll come in and say, well, I think this is it, and I go, well, here's HRT. I think that's the big thing to get across to people is actually there's a process to go through here to find out what fits with you, what's best for your lifestyle. It's no longer this is on a tablet or not, breast cancer risk or not, bones good or not. It's having that conversation, what best fits with you. And all GPs will be up for that. They may even say, go and see our specialist GP on the menopause. And that's your gateway in. But it's talking about and asking the questions is so important.
Brilliant. I'm just thinking, mastermind topic. I could go and talk about the menopause. That would be a really good thing. Honestly, thank you so much for your time today. And it is just really important. Go and see your GP. They can be helpful. And there's no point in suffering. There genuinely isn't, because there's so much that can be done. Thank you so much.
Not at all.
Thank you.